Hi, my name is Dr. Sandra Dorman, and I'm the director of the Centre for Research in Occupational Safety and Health. Today, on the Northern Ontario Community Immunity Series, we're talking about how you can talk to your loved ones about COVID vaccination. To see the entire series, please visit our website at CROSH.ca. We recognize that it's important to talk to our friends and our family and our loved ones and our coworkers about COVID-19, even though it can be challenging. It's challenging because it can trigger really intense feelings like fear or anger, frustration, sadness, and individuals want the freedom to choose to do what's right for themselves and their families. And there's a lot of new information that's coming out regularly. We've been in this for almost 2 years, and there's absolutely a lot of misinformation that's being shared out there. And so sometimes it's difficult for people to understand or to know what's the right or the good source of information to follow. The purpose of this part of the series is to try and give you some conversation starters, some tips for having a meaningful conversation with another person in your life about COVID-19 and vaccination. Keeping in mind that conversations can be emotional, and particularly when they become emotional, they become unproductive. So you probably will need to have multiple conversations, and you probably, want to try not to go to that emotional space yourself if you're initiating the conversation. You also need to know that it's hard for people to change their minds, and they don't usually change their minds quickly. And so expect to have more than one conversation about your issue of concern. And probably most importantly, understand that people don't like feeling judged, ridiculed, disrespected, or that their concerns are being dismissed. And so you're not going to have a productive conversation if that's the place that you're coming from. So actually, the place to begin, if you want to have a conversation, is actually to start with yourself, right? And ask yourself some key questions like, why does the person feel the way they do about this issue? Try and put yourselves in their shoes. What's important to this person in my life? And maybe what are they trying to protect? What are we both concerned about? How can I show them that we have common goals or priorities? Right? Where do we align? What sources of information does this person trust? Do they trust me? And if they don't trust me, maybe there's somebody else they should be talking to who is someone that they trust and that they would feel comfortable having this difficult conversation with. And last, but certainly not least, you need to ask yourself, am I in a good headspace to actually listen to what they're saying with an open mind and also to keep my personal cool? Because if you're not, it's not the right time to start this conversation. Second tip is you're not aiming to convince. You're aiming for contemplation. So what that means is if you accept that multiple conversations are likely required to change someone's opinion about something, then you don't start the conversation with the goal to change their opinion. You start the conversation with the goal to get them thinking about, some of the points that you have to make, to get them contemplating the issue. So then, how can you start the conversation? Well, start by asking some open-ended questions, right? You're not going in there to lecture. You're going in there to have a discussion, and a discussion means that you're going to ask them questions about what they're thinking and what their beliefs are and what their concerns are. So for example, do you want to talk to me about the reasons behind how you feel about vaccines? What about vaccines makes you uncomfortable? How do you feel about your risk of getting COVID-19 or what this might mean if to your family or your workplace? Key here is to listen without interrupting, right? Listen to the entire explanation they give you without jumping in to correct or to answer. Listen. And then acknowledge that their concerns are valid. You don't have to validate any misinformation they might say, but you should affirm that what they're concerned about is important. So for example, I'd be worried about needing to miss work too. Or I also feel overwhelmed with how much information is out there and that certain messages have changed. Then, things are going well, you can ask permission to share what you've learned, right? And so, for example, I was worried about that too. Can I share with you what I learned from sources that I trust? Right? Asking permission, again, because people don't love being lectured at. Share with them where you learn the information. Always try to pick expert sources, particularly sources that they would be open to listening to, right? So it could be a family doctor, could be a paramedic or a medical association, or somebody, a trusted leader in your life or community that they would be open to listening to. The other thing I just wanted to tackle was, what do you do if someone is sharing misinformation? And that's tricky because misinformation, it's rampant. There's lots of misinformation out there, but nobody likes to be told that they're wrong or that they've been misinformed, right? And so you have to be careful about correcting somebody on misinformation. And I think the first point here is to decide when you want to engage. Typically, a public engagement around misinformation is not very productive because it may end up being more about pride or feeling like the other people in the group are watching the interaction than actually about having an open discussion about the information. So if you want to engage a person on misinformation, you might want to do it in a more private format. And then the approach that is recommended is an approach that's called the fact sandwich. I like this. So the fact sandwich has 4 parts, and it's called a fact sandwich because part 1 and part 4 are the fact, right? So you start by correcting the information. So somebody gave misinformation. Step 1 is, this is the correct information. Step 2 is then you warn about the misinformation. Step 3 is you explain why it's wrong, the misinformation, and share what is correct. And then step 4 is going back and repeating the correct information. People tend to remember the correct information if you say it twice, especially if you say it in front of and at the end of an explanation. And so that's why you do the fact sandwich. So let's do an example. So this is an example where somebody is saying that COVID-19 vaccines impact female fertility negatively. Start your fact sandwich by affirming the concern that they have. Okay, so for example, I've heard similar concerns from my friends. You lead with the fact. COVID-19 vaccines have no impact on female fertility. Step 2, the warning. There has been information circulating that COVID-19 vaccine could hurt your chances of successfully conceiving and carrying a baby, but that's not true. Step 3, explain the misinformation and explain why it's wrong. So for this example, this information or this misinformation comes from an opinion letter sent to the European Medicines Agency, which inaccurately speculated that the protein in COVID could interfere with the placenta and cause a fertility issue. However, the international health organizations have found no plausible mechanism for that speculation. And so back to fact 4, there's no evidence that COVID-19 vaccines have an impact on female fertility or miscarriage. And in fact, pregnant people should really get vaccinated because if they get COVID-19, they're 5 times more likely to end up in hospital and 10 times more likely to put in the ICU. So vaccination is actually very warranted for pregnant women. So hopefully you got some useful tips here to take you into your next conversation. And next up on the Community Immunity series is, what is community immunity? As always, we'd like to thank the Natural Sciences and Engineering Research Council for funding the Northern Ontario Community Immunity series. Thank you for tuning in, and I look forward to seeing you again. Bye-bye.